Okay, now we're going to move on to the hand. I'm going to go through some of this material possibly rather quickly, so we will go through it again as we get into the lecture this week. Just a reminder, we are making reference to a couple of different joints here. We have the carpometacarpal joint, the CMC joint. That's where the metacarpals 2, 3, 4, and 5 join the foremost distal carpals of the wrist, the hamate, the capitate, the trapezoid, and the trapezium. Now, we have metacarpals 2 through 5 shown here. Number 2 is the index finger. 3, 4, and 5 are the middle, ring, and small finger. We also have a metacarpal joint at the thumb that we're going to rejoin a little bit later. Couple of things also to know and understand in terms of the joint. That joint is an irregular joint there in 2 through 5 only. When we talk about the thumb CMC, we see something quite different. There is a little bit of flexion and a little bit of extension at the CMC joint in this here in the sagittal plane, but it's not necessarily a degree of freedom. The motion is important, however. This is important for allowing the you to cup something in your hand and sort of roll those carpal bones and metacarpals together so that you can hold something in your hand like a coin or some water or a pill or something like that. Just want to bring to point too that the arches of the hand are formed by the union of these bones, allowing those arches to occur. And the arches are incredibly important for functional use of the hand. Without the arches, we don't have good functional use of the hand. So the CMC of the thumb is a little different. That's where the first metacarpal number 1, articulates with the trapezium. You can see that there. It is a saddle joint. We've talked about this before. It is there's quite a bit of mobility there at that joint, which makes it, as we know, very unstable. It is very prone to arthritis because we don't use it properly, and we've talked a bit about that in class already. All right, so in terms of the types of joints that we see, we talked about the saddle joint. The saddle joint actually has, well, for some reason this says 3 planes of motion, but I've changed it in my PowerPoint or in my lecture material because I want you to think of it just as in 2. The third would be the rotation for opposition, which is really sort of synonymous with circumduction that we've talked about before, which is really combinations of ab and adduction and extension and flexion. So we're gonna go with flexion extension. We're gonna go with Palmar, AB, and adduction. I will bring this up in class more and show you these motions. Flexion and extension is synonymous with radial AB and adduction, so make a note of that. We'll be using the terms radial and Palmar, AB and adduction instead of flexion extension and Palmar, AB, and adduction. So you'll understand that a little bit better when we get into class. It is a biaxial joint, okay? So let's take a look at the next joint out, the metacarpal phalange joint. That is where the metacarpals meet with the beginnings of your fingers. We have one in the thumb, and we also have it in 2, 3, 4, and 5. So that is your knuckle, essentially. So the metacarpals are covered by skin and where you see your fingers begin is at the MCP joint or the metacarpal phalange, and sometimes it's referred to the MP joint as well. All right, types of joint there are biaxial condyloid joints. Biaxial meaning 2 planes of motion. We have 2 degrees of freedom. We can do flexion and extension at those metacarpal phalange joints, and we can also do AB and adduction. However, they are only biaxial condyloid joints in 2, 3, 4, and 5. The thumb MP or the thumb MCP does only have flexion and extension. The best resting position as well for that particular joint is at about 70 degrees of flexion. So when we get into doing our splinting, we're going to be trying to achieve that. All right, next joint up is the PIP joint, the proximal interphalangeal joint. That is where we have a connection between the proximal phalanx and the middle phalanx. And we have a PIP joint in 2, 3, 4, and 5. And these arrows are awful, so don't pay attention to them. In the thumb, we only have an IP joint. So we don't have a PIP or a DIP in the thumb. So these are 2 through 5. And then here we have the distal interphalangeal joint. So we have one in the thumb, or what we call the thumb IP, and then we have a joint between the middle phalanx and the distal phalanx of 2, 3, 4, and 5. DIPs, do not call them dips and pips. All right, PIP and DIP joints are uniaxial hinge joints. That means they have 1 degree of freedom of motion. They only move in flexion and extension, and their best resting position is going to be in an extended position, almost full extension. So again, when we do splinting, we're going to see, we're going to try to make sure that we splint those in a fairly extended position. All right, we've got lots of ligaments in the fingers. Now the fingers are only supposed to do flexion and extension. So we have several ligaments. We have collateral ligaments on the radial side and collateral ligaments on the ulnar side. So they basically go down both of the side surfaces at those joints to prevent any AB or adduction. We also have on the palmar side, or the volar side, a volar plate, and the volar plate is important to keep the fingers from dislocating backwards. And so you'll notice if you palpate your joints on the palmar side that there's a thickening of the joint capsule. There are no ligaments on the dorsal side, because if we had this volar plate on the dorsal side, the fingers would be quite limited in their ability to flex. All right, let's take the movements of the fingers. At the MP joints, or your knuckles, we have flexion, and the muscles that are responsible for that are the lumbricals. And the lumbrical means worm-like, so that's the primary mover of MP flexion, and we'll talk more about this in class. The muscles that help with that are the flexor digitorum superficialis and the flexor digitorum profundus. We'll talk more about those as well in class and go over some ideas about how you can remember that. We have abductors of the MPs. The muscles responsible for that are the dorsal interossei. Best way to remember it is with an acronym DAB, D-A-B, dorsal abduction. Bad arrows. Okay, on the palmar side, we have our adductors. Those are interossei as well. Those are the palmar interossei, and the acronym to remember those is PAD, P-A-D, palmar adductors. For flexion at the PIP joints, the primary muscle responsible for that movement is the flexor digitorum superficialis. The secondary or helper muscle is the flexor digitorum profundus. Again, I will show that to you in class. Flexion at the DIP joint is primarily is produced by the flexor digitorum profundus. Now, in the wrist, we have a pulley system produced by something called the flexor retinaculum. The flexor retinaculum is essentially kind of like a bracelet. We have one on the flexor side and one on the extensor side, and I will show those to you in class. The transverse carpal ligament is on the palmar side. The transverse carpal ligament is the ligament that we release in a carpal tunnel release. This is a ligament that holds all kinds of things real tight beneath it, including the median nerve And so I will show that to you in class as well, but that is typically what we're going to clip in a release for carpal tunnel. Um, we have several annular ligaments that hold our pulley system in place in our fingers. If we didn't have these ligaments, we would end up with essentially like a bowstringing in the fingers. And I will explain that to you in class. I do not require that you know these A1, 2, 3, 4, and 5, but to understand that there are ligaments that go all the way around and hold those important tendons of the muscles that control the fingers in place. We have cruciate ligaments as well. Cruciate ligaments also hold those pulleys in place. Those are those cross-shaped ligaments there on the palmar side. And again, 1, 2, and 3, but I do not require that you know that. Just understand that they are important to keep all that stuff from bowstringing or hanging out in a slack way. The palmar fascia, what do I need to tell you about that? The palmar fascia is connective tissue that runs in the palmar surface. Really, basically, holds your palm tight to, tight to the bones and the muscles that are in that area. And we can sometimes get flexion contractures because some of that stuff gets kind of tangled and held up. I'll talk about that a little bit more in class. Okay, extension of the MPs or your knuckles. Extension is primarily produced by the extensor digitorum communis, EDC. Extension of the PIPs and DIPs is primarily produced by those lumbricals. Now the lumbricals produce flexion of the MPs, but extension of the PIPs and DIPs. Also, the helper muscle to that continues to be the EDC or the extensor digitorum communis. Now, in the index finger, we have specific muscles that control that finger because it has a lot more skill to it. So we have the extensor digitorum communis still working to produce extension. But we also have a muscle called the extensor indicis proprius. Now, what I want you to know and understand is that when you see the word indices, that relates to the index finger. If you can remember the extensor indices proprius, that would be nice. But primarily, I want you to know when you see the word indices, that means index finger. Extension of the small finger. The small finger has its own extensor muscle, and in addition to the extensor digitorum communis, the extensor digiti minimi is an important extensor of that finger. And again, remember the concept of digiti minimi relating to the small finger. The extensor hood, what can I tell you about that? More structures there that really kind of help keep things in line nicely on the top surface. I'm not going to require that you know. The extensor retinaculum is the other part of the bracelet on the back side of the wrist that again produce this pulley system that allow all those structures to run through there. The muscles of that control the fingers in the hand are all located in the forearm. They're for the most part are extrinsic, so that's why you see a lot of these tendons moving through this space. Again, another important bowstringing prevention, and I will talk about what that means. Okay, the first dorsal compartment does hold some specific muscles. The abductor pollicis longus is a muscle that controls the thumb. And I am not going to require that you know this. If you want to go on and become a hand therapist, this might be important for you to know and understand. I will try to reinforce a little bit more information about this when we get into the lecture.